University of Cincinnati emergency medical physician Caroline Fryermuth saw the opioid epidemic and the lives it was taking up close.
We see people who have died and can't be revived in the field. We see people who have died and were revived in the field and then come in.
One of the many strategies to combat those deaths was to make the opioid reversal drug naloxone, commonly known as Narcan, as available as possible. Dr. Fryermuth was involved in a recently published study which looked at the impact of blanketing Cincinnati and Hamilton County with naloxone.
Inevitably, there are people who come across people who may have overdosed. You know, I might be walking downtown after shopping at Findlay Market and stumble upon somebody who's overdosed.
The study looked at data from the end of 2017 through the end of 2019.
One of the disappointing things we found was that the opioid overdose death rate really stayed steady across time.
Some people would look at this as a failure. You don't think so, though, right? You think that this shows that it was, I guess, a success in some ways.
True. So, again, we would have predicted that the rate would have continued to rise. And so while staying steady is not a wonderful thing, we do think that it did prevent some deaths that would have occurred had this project not happened.
Here's a look at it. The black line shows the number of reported opioid overdoses in Hamilton County. The vertical line is the start of the naloxone distribution project, and the blue line, that's the predicted number of overdoses.
How bad do you think that did the models show that things could have gotten had this naloxone not been so freely available within the community?
Well, if you look at the graph in our paper, it was really on an exponential rise. We were seeing things really start to take off. More and more people were using drugs, more and more people were dying from them.
Dr. Fryermuth says that the real-world numbers show just that. She says across Ohio, the overdose rates continue to rise in that same time period. Now, she knows that naloxone isn't the magic bullet to the opioid crisis, but Dr. Fryermuth says that it is a critical piece of the puzzle, especially as the more powerful drug fentanyl is making its way onto American streets. In Cincinnati, I'm Christian Hauser. Back to you.
And you can learn more about this study and its results, plus learn more about naloxone and how to get it. Just open the free Local 12 News app and click on the naloxone study article once you are there.
Sure, you could stop watching now, but let's be honest, you want to see more. So click some of those links, or better yet, go ahead and tap subscribe. That way you'll catch more content from Local 12.